Thank you, Dr. Sonal. Uh, I thank the organizers of Field for the opportunity to talk. Starting with Dr. Darren's talk, he talked about patients with ALF in infants with size being less than 5 kgs. He took us into the surgical aspects, the techniques, the need for bloodless surgery, the need for minimizing the anhepatic phase, the fine sutures that needs to be used, and the clamps that need to be used to prevent crushing in the portal vein. The problems were well discussed in the form of large for size syndrome, the abdominal need for abdominal wall reconstruction, and trying to delay it if the graft is too large. Various variables contributing to mortality, like creatinine, INR, and donor age, were discussed by him. And he did show that if it is recognized timely and the correct selection is done with ruling out contraindications in the form of mitochondrial disorders, and good technique is followed along with the availability of good pediatric anesthesia and critical care facilities, then the results of acute liver failure in infants is very much comparable to what happens in bigger children. Next, summarizing Dr. James' talk of precision medicine in hepatitis B. He started the talk with how hepatitis B is increasingly coming in older age individuals, higher incidence of HCC, and less of them presenting with decompensation now, and how with the available medicines, viral suppression is possible and sterilizing cure is still a distant dream. And with the decreasing use of Hep B immunoglobulins, how transplants are being done. He talked about the cascading cure, right from viral suppression to the sterilizing cure. All entry points for the virus, the viral entry inhibitors in the form of cyclosporin, interference of mRNA activities with use of small interference RNAs, the inhibition of nucleocapsid formation with core protein allosteric modulators, immune inhibitor pathways using nivolumab. All these things were discussed, and he did conclude that at this point of time, possibly sterilizing cure is not possible, and a combination of all these different agents could be used in the future to be able to achieve a sterilizing cure. Coming to Dr. George's talk, it was an excellent talk on acute on chronic liver failure. He stressed on the importance of differentiation of acute decompensation versus acute on chronic liver failure, which has a cells component contributing to higher mortality, and MELD scores being not indicators of mortality, and organ failure with the use of CLIP SCOPA scores is more important to achieve the predictor of mortalities. He stressed on the importance of how grade 2 and grade 3A ACLF patients need to be treated and stabilized before pushing on the path towards expeditious transplant. And when CLIP SCOPA scores of more than 64 with 4 organ failures were there, and we are not able to stabilize the patient, and we need to explain futility of care to these patients. He did summarize and ended the talk with the role of plasma exchange, showing his data on good survival. So these are about the talks today. So all the talks, I believe, were very good and informative, and we thank all the speakers on behalf of Phil for the excellent talk. Thank you. Thank you, one and all.